All right. So, obesity and overweight are typically used interchangeably, but they do refer to different health problems. Okay. Overweight is when there's an increase in body weight for the height. It can be up to 10% greater than the ideal body weight. A BMI of 25 to 29 is considered overweight. Now, obesity is when there's an excess amount of body fat when it's compared with the lean body mass. The normal amount of body fat for men is about 15 to 20% of body weight, and for women, it's about 18 to 32% of body weight. Now, 20% above the upper limit of the normal range for the ideal body weight would be considered an obese individual. Also, anyone with a BMI of 30 or more is considered to suffer from obesity. Morbid obesity is also called extreme obesity, and it refers to a BMI over 40. Okay. If you look on page 1246, highlighted in blue, we have leptin, adiponectin, resistant inflammatory cytokines, apolipoprotein E, cholecystokinin, and ghrelin. Now, orexins are appetite stimulants, and anorexins, they decrease appetite. Okay, some people that have high levels of leptin, it's supposed to control appetite, but for some, they may experience leptin resistance. Okay, um, complications of obesity, we see cardiovascular and respiratory problems. Um, More common complications of obesity are listed on table 60-3 on page 1247. We see hyperlipidemia, coronary artery disease, stroke, depression and other mental health problems, and gallstones. Okay. The most common cause of being overweight is eating high fat and high cholesterol foods, okay? As well as physical inactivity and drug therapy can contribute to weight gain. Now, whenever we are getting an assessment on these patients, we want to make sure that we're obtaining an accurate height and weight. Um, Whenever we're assessing the skin, it's important to remember that yeast grows in places that are warm and dark. And a lot of the times, individuals will have skin fold areas like their breast or their abdomen, and their breasts are known as pendulous breast, and their abdomen is known as a panniculus. That's when they have that skin fold on their abdomen. And these areas are the areas we need to be concerned for yeast growth. And the infection of the panniculus is actually referred to as panniculitis. Now, we want to make sure that we're asking the patient questions. We want to know their psychosocial input on food. So, what prevents the patient from losing weight? Do they want to lose weight? What does food mean to them? Okay. We also want to explore any attempts at weight reduction. We want to explore the effects of obesity on their lifestyle. Okay. There are different types of non-surgical management that we can do for these patients, such as diet therapy. We can put the patient on a very low calorie diet. We can also have them take in the proper nutrients. We can also have them initiate an exercise program. As far as drug therapy, we have anorectic drugs, and these suppress the appetite. Phentermine is a very commonly known drug for weight loss. Ally is also it's an over-the-counter weight loss product, and it's very widely known. Now, we do have to worry about side effects of these medications for these patients. Now, with phentermine, suicidal thoughts can occur, and if suicidal thoughts are occurring, we want to make sure that we are reporting those to their provider. Increased heart rate and hand and feet tingling are also common with phentermine. Now, surgical management, we can see liposuction for these patients. When we talk about patients that are suffering from obesity and obesity related diseases, we term that bariatrics. Okay. Um, with these patients, before they undergo any type of surgery, we always want to reinforce teaching, especially health teaching in preparation for surgery. Okay. There are different gastric resection surgeries that allow for the um, the proper nutrition uh, to be taken in, okay? Because some gastric surgeries, the patient loses that ability to take in those nutrients, and they have nutrient deficiencies, okay? We have the lap band or an adjustable band. It's figure A, 64, figure 60-4A. That is the placement of the lap band on the stomach. And then we also have gastric bypass, which is in figure 60-4B. Okay, so we want to make sure that we are providing proper airway management for these patients post-op. We have to remember that their stature can compromise their airways, and we may need to place these patients in the critical care unit because sometimes we have a hard time weaning these patients off of anesthesia. Okay. Um, to prevent complications, we want to make sure that we are applying those TEDHOs, those SCDs. We want to make sure these patients are getting a prophylactic anticoagulant. We want to monitor those O2 sats, okay? If the patient uses a CPAP at night, we want to make sure that patient has that CPAP available, okay? We want to promote early ambulation. We want to make sure that patient has an abdominal binder to prevent any type of dehiscence. We also want to observe those skin areas for any redness or breakdown. We want to make sure that these patients are, turn, coughing, and deep breathing. Okay. Also observe for signs of dumping syndrome after gastric bypass, so we can see nausea, diarrhea, abdominal cramping, and tachycardia. Okay. Make sure when you're looking at these different types of management in these patients with malnutrition, make sure that you are understanding what can lead to the malnutrition, what we do to help the malnutrition, and what complications can arise.